As a matter of fact,
Kindergarten graduation is 6:30. 8 relatives in my house have homes. Didn't get to them yet. I'm talking about after I'm done here. I want to show you the update that I did with project.
oh, yeah.
Just make sure I haven't missed anything. All right, okay, we are, Len's not coming, and Karen will. We'll just wait for Mr. Scott.
Go ahead, I'm sorry. I was just saying 3 minutes on the presentation.
Good morning. I'll go ahead and call to order the May meeting of the Housing Authority of the City of Omaha Board of Commissioners. You get a roll call, please. Commissioner Lambert.
Here.
Commissioner Berglund. Here. Commissioner Gregg.
Here.
Commissioner Bradford. Bradley. Sorry, no, I wrote Bradford.
Here. My name should.
Forgive me.
You haven't
And
seen
Sir
me.
Taylor. Would that be Woody or Dan? Commissioner Sir Taylor. Here.
Here.
And Commissioner Watson. Here. Our meetings are governed by the open meetings law. Copies which can be found on their table in the rear of the room. I believe we have public comments this morning.
Absolutely. Our first is Clinton Sloss with Heartland 2050.
Hello, everybody. I've been told to be brief, my best. Pass around a little handouts. It was 3 pages to the handouts I'm going to give you. The first is just a one-page overview of where we're at with the project. We've been, those that were refresher, Heartland 2050. Basically, we're looking at the 8-county metro and how we're going to grow over the next 40 years. And so we're trying to bring together a bunch of partners across the metro from cities, counties, private enterprise to start having conversations about that type of development. Housing and land use development are a big piece of that, and so that's why I'm here talking to you today. So this handout here is just a brief kind of overview of activities in the past year. The next handout I have for you is a survey. This is a printed version of our survey. It's also available on our website at heartland2050.org. It is up through tomorrow, and so if you are interested in taking the survey, we really appreciate your input. What we have here, we've created 4 potential growth options for the metro, and we're asking for your thoughts on those and opinions. So if you could do that, that'd be great. Share it with your friends, family, and networks. We'd appreciate it. And lastly, the last handout I have for you, we are at a point where we are starting to come together and create this actual regional vision document called our blueprint. And so we are creating what we call vision committees, which is basically pulling together all of our working groups that we have with the project and trying to get them all to the table. And so we have kind of 4 different groups we've come up with. One being people, which includes health, education, economic development, workforce, poverty, and public safety. Then we have resources, which is agriculture, food systems, disaster and flooding preparedness, access to nature, parks, and natural resources. And then we have places, which is broken up into 2 groups. We have infrastructure, which is made up of transportation, roads, transit, utilities, and technology, which includes broadband. And then places for housing and development, which is probably most of interest to you here, which includes neighborhoods, development, urban form, infill, creating new communities, and zoning regulations and costs. And so what we're doing there is we're having some kind of work sessions on June 11th at the Community Engagement Center at UNO. And so I ask you to consider being part of these conversations and giving us your input on this process if you're available. So this here is a schedule of those meetings. If you're interested, please feel free to contact me at NAPA. Mr. Scott has my contact information if you need to speak to me directly. I also like to say that Ms. Berglund and Ms. Taylor is part of the NAPA council officials and have been part of the project as well, and been great partners in the project. So, any questions or comments?
I am a member of the steering committee, so OHA is well represented.
I've been at most of the past member meetings, last, we've had 3 different venues, so I'm sure I'm involved.
Yeah.
particularly interested in if you talk to any of the Neighborhood Alliance individuals and the Empowerment Network.
Yes, very much so. Power Network is a part of the project.
Okay.
Vicki Quakes-Ferris is on our steering committee and our equity engagement committee. We have connections with all the Neighborhood Alliance groups. We've reached out to all of them, the leaders of those groups.
And Kevin's a part of
The
it.
president. So we've been hitting the streets, been trying to get as many people as possible to be part of the project. So if you have those suggestions, we'd be more than happy to take those.
No, if you reached out to those groups.
Yeah.
And they, okay, that's what I said. Thank you.
Also add just, I think on top of the engagement at the kind of director level, getting residents to respond to the survey, I think would be really helpful because that is the content that's going to shape kind of the future of the strategy. And so getting their input would be really helpful if there's a way through resident services or however to get those surveys
And
responded.
maybe they can make a presentation at the CAC.
CAC next. Okay.
You mind that now?
Yep. Think that would be nice.
If you guys can do your, it'll be longer, you can
Sure.
kind of, explain it a lot longer at the, we have a residents council meeting.
Okay.
Meets every second Tuesday, the first Tuesday of the month.
First Thursday.
First Thursday.
Okay.
Is that 1:30?
Okay. I will.
This location.
Okay. I will maybe check with you on the dates or the website. So.
Great.
And you can talk to Sal.
Okay.
Yeah.
Thank you very much.
Thank you.
Next we have Charles Drew, representatives in McMorris.
Good morning, everyone. I'm Kenny McMorris, CEO of Charles. Recently appointed CEO 30 days into the business, so I'm happy to be here. My colleague Rudy Cooper, who is our public housing clinic coordinator, he's responsible for the day-to-day operations of the site. We're here today just to kind of give you all a general overview of what we've been accomplishing over the last year and a half after the pandemic here. I'm sorry we don't have enough for everyone, but we'll get more information out. But basically, about 2 years ago, we embarked on a partnership to bring healthcare, quality healthcare to residents within public housing. Currently, we're operating in 4 locations. Crown Tower, Lawrence Tower, Evans Tower, and Jackson Tower. Our staffing makeup is one of which we have a nurse practitioner, medical assistant, behavioral health therapist, and a community engagement person. That person is responsible for enrolling people in the healthcare marketplace as well as within Medicaid. Generally, for the most part, we know our population, we know our residents. A lot of our residents, from a chronic condition standpoint, we're seeing a lot of those with diabetes, hypertension, cardiovascular disease. And we play a significant role in trying to address those issues with residents. What we've been finding over the last year and a half, as a general, the community as a whole, is there is a huge gap in terms of health literacy. And so it's getting the population to understand the importance of quality health care, being more proactive and being more engaged in how you engage your provider is really our charge. And so we spent a significant amount of time, and we'll continue to spend a significant amount of time on just educating the population. So as you know, you can have a service and provide a service, but if people don't understand the value of that service and recognize it's there for them, it makes it difficult to get access. So on average, we're averaging about 80 visits a month. We rotate to each location, each site 1 day a week. Now, as Charles Drew grows, we plan on getting actively engaged and having more of a meaningful relationship with the academic and hospital institutions. That will provide us a greater depth in terms of being able to get resident students in, students from College of Nursing, to help expand our reach as we try to provide access to residents. One other area that we're going to look to try to improve on and increase in is in the area of dentistry. Right now, we're not providing services on site for the residents. We do provide transportation back to our main location for dentists for dental appointments. We plan on probably doing some type of portable mobile units for the residents in the housing topics. Another area we plan on growing is in the area of just reaching out more to all residents within the housing authority. We spent the first year and a half, 2 years, really concentrating on the towers. And so now we're starting to hear and feel more of the importance of really reaching out to all of the housing authorities. So we will spend a significant amount of time on that. I'll be the first to say the first year was probably, we learned trial by fire. We're one of the few FQHCs in the country, federally qualified health centers, that actually has this particular program. Charles Drew is blessed to really serve special populations. We also serve homeless populations. So we're very excited, very happy, and very grateful and thankful for you all's partnership. But we really plan on growing and questions?
Could you repeat the staff that you have?
Yes, one nurse practitioner, and basically, we call them mid-level, so a nurse practitioner or physician assistant is a step under a doctor, if you want to call it that. All of our nurse practitioners have a collaborating agreement with one of our main docs back at the main office, so they use them to bounce ideas. If there's a case that's pretty challenging for them, they'll call in and say, hey, I'm experiencing this particular situation. What do you think is the best way to address this patient? We also have a medical assistant. The medical assistant is responsible for supporting the nurse practitioner and everything that they need. So it may be drawing immunizations, asking appropriate questions, prepping the patient for the nurse practitioner. But in our system, they also serve as the front desk person. And so that's getting all the basic intake information, demographic info, to make sure we have a comprehensive history of the particular patient. And then the community engagement staff. That individual is responsible for reaching out to all the housing residents and beyond that, all the OHA residents on their options as it pertains to health insurance. And so we know the health insurance marketplace, we're in a downturn, the marketplace will open back up in November, but we're educating the population on that, but also enrolling those that are Medicaid. Medicaid is year-round. And so getting individuals to understand what their options may be as pertains to Medicaid. And then, of course, our superstar here, Mr. Cooper, who keeps it all together.
What about transportation to and from the doctor?
Yes, we do have some limited transportation. That is one area we're trying to grow. But if there's individuals outside of the tower that wants to get to one of our clinics, we'll provide transportation on the individuals for them. And some specialties services as well. So for those that may need to spend some time with the podiatrist or that back in the clinic, we'll provide transportation.
Limited transportation, you in the tower, but you're not in out of the tower. So can you take us to?
Absolutely. We are more than willing to take any of the residents.
So who do we call for that?
We'll get in touch with
Card?
Yeah, he has some cards. You can actually talk with any of the staff at the locations as well. Sorry, one more staff person, behavioral health. Sorry about that. We have one therapist, Ted Lumpkin, who's basically responsible for doing a lot of intake, managing the caseload for any of the residents that need behavioral health therapy, and then also being able to get them in touch with psychiatrists, psychiatrists on a regular basis.
Are you doing anything with medication management? Are you keeping medication on site, or is it at your clinic?
Yeah, the medication is at our clinic. We do have some limited medication, basic things. We also do keep some immunizations on stock as well. But it is a full-fledged clinic to a service.
Okay. Last question I have. The OHA and Charles Drew and another organization I'm involved with, we're involved in a collaborative that's coming up on the Medicaid side. And I actually talked to Mr. Scott and Mr. Suck about this just the other day. I'm hearing you talk about the community engagement staff. I know this effort is looking to put community engagement staff inside OHA. Do you see any conflicts with the staff that would be here with OHA and what your coordinators and enrollment counselors are doing?
No conflict. Quite frankly, we encourage it because we know that the need is so great. We have one person who's just responsible for the population. We know how many residents individuals should have. We can never oversaturate the market as it pertains to education. Again, we find ourselves spending a lot of time, I mentioned health literacy, but also the financial literacy aspect. So just getting people to understand really what options they have available financially and how it pertains to health insurance enrollment. So no, I think it'd be a great partnership. I think we'll be in good shape. But frankly, we need more people to really address the issue and make sure people have options.
Thank you, Bert.
I'm on the board of Ronald McDonald House, and we were elected using the care mobile.
Yes, so actually we're in the process of trying to, the Care Mobile is a product of One Works, what they have there.
And Ronald McDonald, we pay for half the cost.
And so you may be someone I want to speak with.
Because I know there's been some issues.
Right, we are very interested in having a Care Mobile in North Omaha with Charles.
Good. We do need to connect.
Absolutely. I do have one more thing, I'm sorry to take it.
I just have James and Rich. I have just a couple questions. You talked about the FQHC status. So do you receive like special federal funding to implement that within public housing?
Yeah, so about 3 years ago, we submitted a proposal to the federal government to partake on this journey. And they did fund us, actually about 4 years ago. They came back, they told us no, and then we went back again, they told us no, and we went back again, and they said yes. And so they gave us starter funding, so basically the infrastructure, the build out and retro, and I said the team has been great through the whole process. We really spent a significant amount of time trying to make sure the health center fit the needs of the buildings and they would work with the population. And so we did get startup costs to basically build out some operational funds for the first year. One thing I failed to mention is that all the services that we provide are not necessarily free. So one of the things that we have is a sliding fee scale for individuals that do not have insurance. And we do bill Medicaid, Medicare, and private for those that don't have it. But again, we spend a significant amount of time just making sure everyone understands that the services are paid. I think that's one of the big things we're finding, and thanks to Mary Thornburg, she actually is a resident in Grand Tower who actually sits on the board. So one of our requirements is that we have someone representing the population. She brought up a really interesting point at one of our board meetings, is that we have a lot of residents that actually have insurance and they have a doctor on their insurance card. A lot of the residents believe just because that name is on the card, the only person who can go. That's not the case. If they want to get services from us, if they have a cough or something that they say, I can't quite get into my doc, go right down to the services.
With the meetings that you'll be, that you have in place already, how are you kind of measuring the effectiveness of that education outreach, and what are the outcomes associated with that?
So when you look at, especially with the meetings, it's more of a qualitative on the front end right now. I think over time, we'll start seeing, as I mentioned before, we're averaging about 80 to 100 visits a month. And so the thought would be, as we continue to keep getting the word out, getting people more comfortable, we'll start to quantify the number of visits. As I mentioned before, I think we're kind of saturated at the 4 locations, and we spend a significant amount of time at those. Now we're going to try to grow the depth and reach of the program and services that we offer. There are some other metrics that we'll start looking at. I don't have that data, but we'll make it available. What are the top 10 diagnoses? What are some of the top concerns that the residents are having? We'll have it available for you all. We do report it out just in that.
Again, Chair Taylor, this was just very quickly, and this was aside from your presentation. There had been some issues, and Commissioner Bradley pointed them out. Didn't point them out specifically, but there had been some issues, and I just wanted to take the opportunity publicly on the record. Thank you for being aggressive, moving forward, recognizing that there's some issues that need to be addressed, and you're addressing them in an aggressive and honest and fair manner. And I just want to compliment you on the work that you've done so far and the work that you'll continue to do. I feel like we've got a good opportunity here, and we've got an organization that is heading in the right direction.
I'll just say, I wanted to say, we want to be fair. Again, Charles has a rich history of being in this community for over 30 years. We'll be fair, we'll be transparent, this community deserves it, and we know how to serve the community best. So if there's any comments, anything that you all believe you can be doing better, give me a call. One thing about is only we'll provide the best service to residents. That's what we do. So appreciate the time this morning. Hopefully we'll get a chance to speak.
Appreciate your efforts. Thank you very much.
Thank you.
Next on the agenda, Mr. Scott.
Man, I gotta tell you, those healthcare guys, I grow up, I won't look like him.
Yeah, but I know you were coming, I was going to shop.
We're awaiting the results of the grade physical needs assessment. Should be here when, right?
Hopefully that has to go on.
Great. So we're more than anxious to see what transpires with that report. We'll share it to the board or with the board and the community. We also notified HUD about our project-based voucher RFP. HUD is excited about new housing being built and rehab in our community. We're looking at 4 to 5, hopefully 6 projects that we're going to submit. So that's going to be a big deal for us and really the affordable housing community here. There also appears to be a new HUD secretary. Obama's signaled that he's going to name the mayor of San Antonio. There will not be a real big shift in policy related to, if his appointment goes through the Senate. So if there's some political horse trading going on, but they're probably going to be a secretary. During our finance committee, everybody got this document? We're going to provide you guys a budget revision here. Michael is next month. Real quick, I know that there were some discussions about, are we going to make it? Are we going to be okay? If you look at the original budget, which was provided to the board and the finance committee, we did that in September, and that was really before the government shut down in October, as well as during that time of sequestration. So we have finally gotten our revenue targets for 2014, and as you can see, that the housing authority is going to be okay relative to a large majority of our programs. Scott was saying this before the meeting today. We have to focus on improving our other operational programs, and that's really what we're doing. Thankfully, Congress had approved a budget for the next 2 years, and that has given us some certainty. So, we provided that. We're going to give you the details and specifics with the actual budget revision, but we kind of get a sense of the feel relative to how we're going to do going forward. Anybody got any questions on that?
Are these, the parentheses, are these good or bad?
No, bankers never want to see those little parentheses.
That's just finance people, so how do I read this?
What it's showing is that revenues are going to be an increase if you look across. And we don't like the parentheses.
The brackets mean that they're revenue items.
Right. That's the accountant side of it.
Okay.
Yeah. And the
Ignore the
expenses,
brackets. Pretend they aren't there.
the expenses are positive.
No, there's no red number
No.
in this document.
But I mean, you look at top line there, we're going to get another $947,000 that we, in September of last year, we didn't think we'd have.
Yeah. We're not rolling in dough, but we're going to be okay. So,
There were some items that we had spoken about in the personnel committee meeting, and I don't remember the specifics. Some of them may have had a slight budgetary impact. Are you considering those? There were some things we were going to do to look forward to, some items we wanted to address next year from a personnel perspective. And some, they were minor costs, but are you also considering?
yeah, we're looking at doing that at RFP.
Yes.
That's promised.
Okay.
Absolutely. We're also, in the development committee, or executive committee, we also talked about streamlining some of our board documents and things like that. That's going to be an investment as well in how we conduct business at the government's level. So we're excited about that initiative as well. Ryan and I are going to DC on a RAD workshop next month. They have strongly suggested that housing authorities that have been designated into the RAD program, and I'll also be meeting with 3 HUD officials on the My Brother's Keeper initiative, and we're going to talk about the GPNA. So, and I'm going to be meeting with Senator Fisher in DC, so we're excited about talking with her and making sure she's aware of our programs. It's interesting. We're the largest housing authority in the state. We represent 67% of all the units, public housing in Section 8 in the state. And I think everybody, and we're talking to the camera too, but things don't happen here as fast as they do, in small programs. That's just the reality. It's like that with HHS. It's like that in some respects with the city. When you run a large organization, given the budget challenges that we've had, historically and last year. You know, things are just not going to move as fast. We've gotten a lot better operationally in how we do things from an efficiency standpoint. At the end of the day, we control 67% of the housing portfolio in the state of Nebraska. That's 2/3 of all the units in the state. And if you put the Section 8 project-based contract administration, it goes to 76. So just understand when you know, we had an email yesterday at 5:30 in the evening, which was after business hours, and you know, some people were asking us to move on some things today, this morning. OHA doesn't always drop the ball. Okay, we're responsive. There are going to be issues and challenges that we're going to have to deal with, but at the end of the day, if we make a mistake, we're going to make it right. And that's the takeaway. We're going to make it right. So the last thing I have is, you know, we had some partners here today with respect to Charles Drew. We had, you know, we're working with the city on and the Empowerment Network on the African American Achievement deal. We're also working with the city on the SCHIP and NCAP and some other organizations. We're going to continue to branch out and develop partnerships. We can't be all things to everybody. You know, our core mission is housing, and that's what we're going to focus on. It's important that we develop partnerships with the business community, with neighborhood organizations, obviously with the city, and developers. So our partnerships aren't going to stop. We're just going to move forward. So I'll take some questions.
Just a quick note, I wasn't here last month, but I just want to acknowledge the staff that, I'm on the board of Project Homeless Connect, and we had staff there. They got inundated. They took over 100 applications that day for housing, and they worked their tails off for about 6 hours straight. So we had about just shy of 800 homeless. The face of homeless is kind of changing. You know, it's always been, you know, veterans and white, but now what it is, there's a lot of families that are now homeless because there was families there, but it's also, it's interesting, it's the 22 to 30-year-old white female that we have quite a few of them, and so the face of how homeless is changing. You know, Jamie's real involved in, but Project Homeless Connect we've done for, this was our 7th year, I believe, and we do it over at Creighton, but the staff here with OHA worked their tails off that day, so I just want to commend them. Thank you.
Yes, thank you. We're going to have more people next year.
Yeah, we're going to slaughter that.
Well, and with that, Scott, it'd be interesting to learn how many of those are housed. I think, you know, you brought over 122 applications, what you said.
Well,
Could we get an idea of in the future how many are actually housed?
Yeah, I'll provide that information. I do know, you know, we did have the significant number that did not pass due to criminal.
That data is just as valuable.
Sure, they're keeping the information separate from them.
Very good.
I just handed out a Father's Day initiative. Sal, you want to talk about that?
Basically, this will be our second year participating in this National Flood Initiative. Last year, we went to schedule 3 events, the south side of Keystone and Spencer. This is actually a national hub where we actually give her the information they actually put on our website. Last year, I think about 90 housing authorities involved with this. I think we was one of them. So it's going to be June 13th at the South YMCA. We'd like to thank Manning and his staff who allowed us to use that building. Last year, we met with George and Chris because we were trying to get a lot of fathers involved. But one of the things that we found out, a lot of it was abandoned park. So they're gonna come on our property, so we end up doing it on the field. So this year we decided to use the YMCA where there are a lot of things to come on the property, do some reading. So, if you're available, we'll be glad to have a board members and staff to attend.
Any other questions?
Thank you, Mr. Scott. Okay, next on the agenda is the consent agenda. Do we have any comments, questions, or anything with pull up consent? We only have 2 items.
Motion approved.
Second.
Motion a second. Roll call.
Commissioner Winter?
Yes.
Commissioner Burgoyne? Yes. Commissioner Gray?
Yes.
Commissioner Redden?
Yes.
Commissioner Watson?
Yes.
Chair Taylor?
Yes. Okay, thank you very much. Move on to report discussion items, budget and finances, our financials. Is going to be Michael or?
Michael, you want to take us through this?
Okay.
I'll make it brief here. We had the finance committee meeting on Tuesday, went through the financials, and from that discussion, going through some of the favorable, unfavorable, there's some budget items that were above budget, under budget. So the discussion centered around the fact that we'll do a budget revision for next month's finance committee meeting for the board. So more of a comprehensive, but with that in mind, we wanted to put together an executive summary with some of the changes which you have in front of you there. For the most part, that listing shows the the budget numbers that were put in before we knew what the actual funding would be from HUD. So there's a column that shows the original and then the revised budget. As you can see from that listing on the right-hand column that shows the in negative, those items are all increases in funding that we know that we will be receiving from like the public housing, Section 8, that fund, et cetera. The last item was the property insurance expense, which in the original budget, a number was keyed in wrong to the tune of a miss of $494,000. So, that was purely an error of incorrect. So at least this shows you that from a funding standpoint, we're going to be receiving more monies than we anticipated. So in the financial, it shows that we're under budget because of these will be reflected in the budget. We went through the financials for the most part. In public housing, for the month, we had positive net income. Year to date, we're under, and that's due to these budget changes. On the Section 8 side, net income was up for the month and up for the year to date. Section 8 admin, net income was up for the month, up for the year to date. The CSCC, net income up for the month, up for the year to date. And the same with HIA. On the balance sheet, agency-wide, the 3 takeaways there are total cash agency-wide is about $8.8 million, which is up $33,000 from the prior month. Tenant account receivable, which is a key indicator, is actually down $67,000 from the prior month, which is good. These collections are better. And the third indicator, accounts payable, agency-wide, is down $112,000 from the prior month. So we're managing cash, increasing that. We're managing the tenant receivables, and we're managing the payables. The payables listing that you have there shows all payables are in the 0 to 30-day category, so we're current on all vendor payments.
Yes, we did say next month we will have the revised budget, which will show in these, and hopefully our variances are a little closer than what if you had a chance to drill down through the particulars on the income statement through each division or whatever. And what we'll do is once Michael does do that, the finance committee will sit down and take a look at these too and be aware of what you talked about, Karen, with the salary situations and make sure we're pretty much on task with some of that. So, Ohio, I was out of town, but they did have a board meeting. I mean, our financials on that are continuing to improve. Our cash flow is fairly decent on that. We're still taking a look at quite a few properties, I think, that we want to take a look at.
Okay, look at some properties, and again, same thing with Ohio, it's kind of depending on the tax exemption issue, which we're waiting for a resolution of, or some decision on. It's going to have a fairly big impact on Ohio, and what we do with Ohio, and what we can do, and it'll make a difference in Ryan's world, it'll make a difference in Ohio. So we'll see where that comes from.
And Michael did point out the payables, and payables are well within line. You look down through that, you can see we've got still a couple big utility bills with MUD at $88,000 and OPD with $140,000 roughly. So that should start to go down now and get us back in line and on budget too with a lot of that. So if there's no other questions on the financials,
Sure.
we can move on.
Any question or comment on our financials? Okay. Asset management, Susan and Terrence.
Good morning.
Good morning.
We have our report for you. We finished the month just over 97% for occupancy. We did have 8 properties that achieved 100%, 5 properties at 99%, and more than half our properties achieved 100% or greater. We'll be more than happy to answer any questions.
You got to talk about Southside. When you lose 10 for a month.
Well, that's interesting. We had a double whammy at Southside specifically. We had the foreman and the zone manager are no longer there. We have 2 major vacancies basically at that property. So Susan is wearing 2 hats. So that was part of the turnover issue. In addition to...
So it points out vulnerability.
I'm sorry?
It points out kind of a vulnerability that we have.
Oh, absolutely. Absolutely. So that was, and also a high vacancy or turnover there that month as well.
Georgia's evicting a lot of people over there.
Yep.
Oh, I'm just a messenger.
Don't blame George.
Also something interesting, speaking of health, Sal and I met with the agency, I want to say Service Works, is the work experience. And so what they're doing is they're training the elderly and near elderly. They're doing a retraining program, and we're actually having one that's going to start at Southside to assist us. And this particular person has a lot of property management experience. So it's more like having an additional employee, but without the cost. So the service agency will actually pay, and we provide the training. So eventually we're hoping to have someone at each site. Sally, you want to add anything to that?
I'm looking at Commissioner
It's
O'Reilly.
a wonderful program.
I just want to thank her for, I sit on the NCAP, and that's how I actually came up through NCAP also. And NCAP is using the same services, and the housing board had used in the past, but it was through a no one. This would be a great opportunity. They actually have a waiting list of staff with some experience that actually trying to find some placement. They were paying them, they work 19 hours per week. They actually pay their full salary. And what we have to do is just find an opportunity for them. They'll be assigned to your agency from 16 to 24 months. So it would be really a great opportunity for us to use that services. So.
It'll make a difference in all of our zone offices having that extra part-time help. So.
When's the summer youth program start?
No, we still wait.
Next week.
It starts next week.
Next week.
How many we have?
Well, we haven't heard as far as assignment yet. I don't know when they're going to finish the assignment, so we just wait to get.
Well, they don't have very long, do they? Because they're supposed to start next week.
Well, the coaches start next week, and the coaches go through training, and the youth are assigned to the oversight organizations. From there, the organizations will work with the youth to select the job site. So you're 2 weeks out from when they would actually come. You mean as a job site, when will the youth actually show up? In about 2 weeks?
Well, yeah, that'll be in about 2 weeks.
2 weeks.
Okay.
School is off this week, right?
Yeah.
Yeah, school is out this week, but tomorrow will be the last day.
Thank you.
Madam Chair, if I can add, just very, George, just in terms of the eviction, and I know they happen, I'm not concerned about it. I just want to know, is there, as you look at them, is there one specific reason, or is it just kind of all over the place? Because I'm wondering primarily about financial, if they're not being able to pay the rent, that's what it is.
75%.
Oh, it's mine.
Are we not reaching them, or are they not attending class? What are they, because I know we run a program that teaches them financial accountability. Are they not participating, or are they not following?
Two things. Before someone, there are a number of layers before someone is evicted. We do a face-to-face, in-house. Sal group also does a knock and talk. One interesting layer is at the time, at the court, we'll also give them an extension to try to give them additional opportunities to pay their rent. We also have other agencies that we reach out to that has actually helped in assisting residents who were, in an extreme case, a resident was actually evicted and agency stepped in, so we reinstated them. So we kick every rock we possibly can to keep them. And as far as rent-wise, we're waiting for, we went through maybe about 10 of the managers went through the rent-wise program, so we're just waiting for us to be certified and to get our access code. So we'll be rolling that out fairly soon.
I think one of the things that I found out, I talked to large residents, especially with the large balances or large amounts of people asking what happened. A lot of times it's usually as the rest of us, it's crisis over there. And the decision to go this side or this side, that's how a lot of people I see in the house. Sometimes, it's a small percentage of people who care. It's a large percentage of people. They do the juggling thing, they just make
They juggle from crisis to crisis. And a lot of that is, how much of that is healthcare?
a large, I've seen quite a few on the healthcare side. I got sick at the hospital or something happened. Our system, we're not supposed to be at least revenue income. So I think that turns into a type of work. So there are safeguards because ultimately, you do it like we've pretty much done everything we can.
And we've had some conversations, and we talked, was it last month in operations, about taking a hard look at how we recertify people, and the timing with which we recertify people, and possibly doing provisional recertification so that people aren't waiting and still paying higher amounts than they need to for them to go through the process. And so I think there was some discussion last month about that, and I believe Terrence and Susan and Gary and Cliff are looking into ways to do that. Correct, George?
We've begun that. I've met with several Southside residents, and what we're doing is we're estimating their rent based on the information they give us, and so they have an amount to pay, so that once the third-party verifications come back and we're able to lower the rent, as George said, then they don't have such a huge balance. They've been hopefully paying pretty close to what it's going to be once we're done, if the information is accurate that we're given. So we have implemented that estimated rent program.
I didn't know Chair Taylor was clairvoyant, because that was the next question I was going to ask. She's already answered this question, so okay.
I was going to be proactive and anticipate that.
And the residents are very.
So we reappointed you for something.
Yeah, there we go. You and I are on it.
Yes, I have one question. When you send them letters, are they certified letters? Because I've got a lot of complaints that people say they didn't get their letters.
We mail them, just regular mail. We do get some, we do not necessarily, those are late rent notices, but other letters that we mail, we do get it back if they don't pick them up at their mailbox eventually, but I think in the towers, a lot of the managers actually hand deliver notices in the
Yeah,
towers.
they're not in the towers, but I've been getting other calls. They're in home.
The problem, if you send it certified, then they gotta go to the post office and during the hours of the post office and sign for it.
Right,
Yes.
And they just, you know, they take that little green slip and just.
right.
And we discontinued.
And they know it's not good.
Complaining that they didn't get the letters.
Nobody wants to.
When you
have
said
it
my
certified
rent is
letter.
increased, but I didn't get a letter.
It's never hated one there.
You got that right.
Right.
Those letters are mailed, when it's a rent change, those letters actually are mailed out of Gateway where the quality control staff is. So the two quality control staff they send out the letters for rent changes, not the managers.
But also, when it gets into Jordan's world, there are safeguards, process safeguards. They have to be served properly, they have to be noticed.
Right.
So it's not like they can be evicted and not know.
Right.
The Ohio vacancies have been up, but we have good news. I mean, we're leasing this month. We did some advertising. We continue to do advertising, and we do have applicants that are interested in those housing units, and we'll be leasing considerably a lot of them as we speak.
Thank you. Any other comment or discussion on asset management? If not, we'll move on to Section 8. Joan?
Good morning,
Good morning.
Commissioner. We have my report. If you have any questions, I'd be glad to answer those. Just wanted to bring you up to date on the waiting list. We have completed our process of taking applications from when we advertised in February. So our waiting list is now completed. We're completed with that. We have right around just a little under 400 families on our waiting list right now. We are servicing those families. Currently, according to my report, as of April 30th, we have 110 families out looking, and they are continuing to provide us with their request for tenancy approvals, and we're receiving probably 10 to 15 of those a day, and we are processing those and getting the inspections processed. Just to let you know, too, that we received our report from HUD, reference to our CMAP, which is our Section 8 Management Assessment Program, where we received a 90%, which is considered a high performer. So I would like to thank Chris Peters, her area, for her inspections, and also Sal, his area, for the family self-sufficiency in addition to the entire Section 8 staff, because that's a great achievement.
Wait, Joe, this was 93.
93. Did I say 93?
You said 90.
Oh,
Need the three.
93.
Knock yourself 3 points.
Well, if it was 90, it was still been 90.
That's a big difference.
93, okay.
Commissioner and Chair Taylor, John, I get, as some of you know, I get calls on a regular basis about OHA. Most of them I handle really well, but I got I've got 3 calls now and I don't think there's anything we can do, but I just wanted to run it past you that I'm getting a call. 3 people have called me. They've got their voucher and they are having issues trying to find Section 8 housing.
Chambers Court has openings. You can refer to Chambers
Does
Court.
Chambers Court have openings?
Yes.
I will let them know, because I didn't know what else is.
Well,
2, 3, and 4.
Chambers Court, they're out on the website. They're listing out on the website,
Okay.
and we provide the families with that.
Okay. Okay. I will call her and let her, well, there's about 3 of them, but I'll call her. The other 2 are
What about Highway 56?
a little bit.
That's separate. We don't
Let's
take
see
that
how
out.
they-
We do have a 2-bedroom, we do have a 2-bedroom handicap unit at the Farnham building, that the Section 8 voucher. We would be accepted there.
Okay. I will let them know.
There was, Mrs. Scott, you communicated to us the need to step in for another housing authority in the area of Section 8, I believe. How is that going?
Joe?
It's going pretty well. It's going to be a process. Right now, we have 80 families that's already been approved. We've already received the paperwork from Douglas County on those families. Those families are currently being added to our Yardy system so that we're able to process and pay those owners by June 1st. After we finish with the June, we're also going to have the people that did not respond to the first set of letters. Those families are also given another opportunity according to the information I'm receiving from Douglas County Housing Authority. And we are going to also, those families will then be affected for July. So we're in the process of receiving that information currently, and then we'll have those families processed, maybe by the 20th of June, so that we are able to pay those landlords affected for July. Now, I don't know if we're going to go into all this, but it really depends on how many families are actually responding to the letters from them.
Okay, but they're communicating with their families, but routing them to you.
Yes, but what happened is they sent out a letter, and in the letter, they had one of our applications with a return envelope to the Omaha Housing Authority.
Okay.
Then those applications were coming to us. Once we received those applications, then we notified Douglas County that we received those applications, and then they're providing us the paperwork for those families. And then once we receive that, then we're inputting that information into our Yardi system and setting those families up in Yardi.
I will say that the last call we had with HUD, they appreciated greatly, expressed a great deal of appreciation to us for stepping in and assisting in this situation. So we've gotten some thank yous and some credit from HUD for doing this. And I know it's been a lot of work for your shop, Joan, so thank you. Anything else on Section 8? Not HIO. We did have a meeting, as Mr. Bradley indicated last month. The notes from that meeting are in your packet. I will take any questions anyone has on HIO. If not, we'll go on to our support department reports. Ryan, Mr. Durant.
Good morning, Commissioners. Here's my report for you. Any questions, let me know. Just to let you know. They started the youth parking lot at Florence Tower this week, and Highlandville will start in 2 weeks. So, and then Pine will probably be the middle.
We anticipate that all the parking lots will be done this year.
Yeah, Benson's going to be the last one, and we're going to put that out probably here in the next couple of weeks and have that done by the week. So we'll be on no parking lots. What's that?
Benson has it.
It's small, but it's there.
Okay. And again, we are still working to move forward on Chandler Place as far as HIO is concerned. You saw that the HIO notes as well as the development committee notes. Development committee met earlier this week as well. You've seen those notes. We're moving forward with some projects there, and hopefully we'll have some good things coming out of that in the next 6 to 12 months. Okay, next item, procurement contracting.
Good morning, Commissioners. You got my report. I'm available for any questions. You might have noticed one news article yesterday that the contractor that's campaigning in Omaha was arrested.
Right. Yes.
He's 99% done with one of our projects. So we're having to take some unusual action. We'll probably end up putting in a project ourselves. So we do have it under control. We don't have anything out of control because of it.
So we don't have to be concerned about any liens from any of his subcontractors?
Yeah, we're protected from all that.
We're protected, okay.
We can't put liens on our property.
So do my question.
They cannot put liens on our property since we're state roads.
Okay.
Any questions? Any questions on procurement contract? No? Human resources?
We had no activity for the month. We still have interviews that we're conducting for those positions that's outside and in finance. Any questions?
Next item, family community services.
Good morning,
Good morning,
Commissioner.
Sal.
Good morning. You have my report in front of you. I'll be glad to answer any questions. Just a couple of things. Operation Curb Appeal is on June 7th, so that's still on. And also a job fair that we had went great. I'd like to thank Commissioner Watson. We ran into a glitches of transportation at the last minute, and we contacted her agency, and they assist with transportation. One thing I would like to say is before the job fair, we actually put all the employees together. There was about 47 of them, and we actually gave the Scott opportunity to say a few words. And one of the things that it was interesting, Cliff had said something to the group, said, hey, I'm the CEO, and one thing I want to do, I want you to look past the initial visit and appearance about the resident, and I want you to take a chance on all of our residents. And he mentioned that we would put, the housing authority would put our credit bill online for our residents. And it was interesting, we got a call a day later from a company who actually brought in 17 people to interview, and the lady just said, really the tree or not. But one thing that your CEO said, they actually gave us a comfort level to give your resident opportunity, and I mentioned that too, but I didn't remember what he said, but it really had a big effect on the whole job fair, and really, they realized that the housing authority just had an impact, not just on our residents, but as a whole, and we would stand behind our residents. Of course, not all of them, right, but at least we have some of them that really have done a good job. So I just want to make the comment, just thank for the staff folk that coming out there, put his name on the line for our resident. He did it again yesterday. I got a call from 3 young kids that called me again and said he had given them a phone number. He said, look, y'all need to find a job. So I don't know, it's a new thing for good. Trying to get everybody jobs. So he's on the road, but yeah, I just want to thank him for that.
You know, I like to, I think everyone knows I like to play basketball. I've always been a big supporter of Lynn Romano and the Y, so, you know, I played basketball during lunch. And you'll see kids from 19 to 25 who just need direction. And, you know, sometimes you're a little bit skittish about sticking your neck out, but you know, at the end of the day, it's our responsibility to make sure that we're leaders out in our communities, our respective neighborhoods, and it's important. And I haven't done that as much as I probably should, but you know, seeing that I'm hopefully going to be here a while, I feel that need, and it's important for us, all of us, to do that. So that was kind of the impetus for me to stick my neck out. And on this job fair thing, real quick, you know, whether you're an employer, small business, or a large corporation, you're not going to make the right decision in the hiring. You're not going to make the right decision all the time. And you know, what I expressed to them was, you know, that those 35 to 40% of the people that aren't going to work or aren't going to stick in your organization. I mean, it's the same percentage if you're hiring our residents. The one thing with us, though, is we can counsel them. We can touch them on a regular basis, like the truancy program. So, you know, I said, hey, let's take a chance on them, because the communication process with us and them is much more consistent than if they just hired somebody who wasn't in public housing. So that was the only thing that I expressed from them, and it seemed to resonate.
Thank you. Could you maybe talk a little bit about what kind of system is in place to track whether or not individuals actually get hired from attending?
You know, one of the things we haven't done that in the past, not for all the companies, we really got a really good relationship with a few of the companies that give us those feedback. But doing our survey, and we actually did a survey at the end of the job, but one of the things that we would like to add is to do a follow-up and see how many people they interview, how many people actually did there, and what was the retention rate. So we'll be able to add that one out of the survey as we move forward. So yeah, you're right. We really need to figure out a way to track down how many people.
We run into trouble with the reliability of the data too when we do those surveys. So we need to figure out a way in which we ask a company and they'll reasonably tell us, yeah, we brought in 10 people, or we brought in 1 person. Right. There's real reliability
Sounds like we have a captive audience with the residents, though. Could we be going through the residents and asking them if they were employed based on their attendance?
Well, yeah, it is. And one of the things, since we had outreach coordinator and those staff who actually case man, we get those information, but I don't know if we did capture all of them, but we do get some. Of course, once they get a job, they have to report that. days to our zone managers also. So we have way to get that information, but I don't think we didn't catch the whole data.
Yeah, be careful.
Yeah.
And then the other question just related to that is, what role did Heartland Workforce Solutions play?
They actually did the pre-employment workshop with that candidate. Did some resumes. Also, they actually sent to our ECC last year, but they actually help us a lot with our job readiness workshop, the interview process, and this kind of thing. And also, they also invite some of that partners. That's how we actually have a trophy company that came through from them also.
Thank you, sir.
Thank you.
Next item is public safety.
Good morning.
Good morning.
You have my report in front of you. If you have any questions, I'd be happy to answer them. As we expected, the numbers have shown in the past, numbers do start to increase as the weather gets nicer. We are still, however, especially on criminal reports, quite a bit below last year at the same time. So, if you have any questions, I'd be happy to answer them.
Any questions or comments on public safety? If not, we'll go to our last report, which is legal. Mr. Chola.
You have the report before you. It's very small. Yeah. Good thing. Out there, the questions you actually have none that is used to look at litigation since the last meeting.
The goal's not one page, right?
The goal is to get it down to one page. Ultimately, and hopefully this first phase of the report will not exist. I don't know if that's ever going to be possible.
I know.
I see we're down on item 1, we're down to 1 listing there.
Yeah, we're down to one. That matters before the Court of Appeals. I'm hoping to have a result of that issue here in the next 2 or 3 weeks. All the customer agrees on the preliminary phase. So we'll see what I have to ask for.
Any questions or comments from Mr. Chola? If not, we move on to new business. We have one item under new business. At our executive committee meeting on Tuesday, we discussed, and I have, one thing I talked about it back in January and over the last couple of months, is trying to find ways to either, to do a couple things. One, centralize board information, find a way to have all of the information that we need or want to access in one place, easily accessed, so that we're not bothering Cole or George or Cliff, or in my case, digging through emails to find, notes from last year or something like that. So, one, centralizing, having a central portal for all of our information, and then also finding a way to use less paper and have more of an electronic access for our board members to board packets. It takes Nicole a couple of days every month to put these together. It takes overtime to deliver them. So there is, and Nicole, are you going to kind of explain to us what you're looking for looking at?
Sure, I can.
Thank you. There's a cost associated with the recommendation that staff is making to us, but in my opinion, and what we discussed was, I think that's offset by the cost savings in time, employee time, and frankly, paper. That I think would balance that out. So Nicole and staff have identified a system that is a cloud portal. It's not just a straight, what you would consider to be a VPN or FTP site. It's actually a little bit more robust than that. So Nicole, you want to just give us a couple minutes?
Sure. I reached out to NEX. It's Nebraska Education Technology Solutions. They used to work specifically for the Board of Education. They, in the last year, have taken this portal and this idea and gone out into other industries. They provide a lot of services for city, county boards, that kind of thing. And the big thing is to go paperless. So essentially what they do is they create a template for us, and we can load everything into a cloud, or we can load everything onto their site. The really nice thing about this is that no matter what device you're using, it is absolutely going to look the same. So whether you're on your phone, or whether you're on your computer, or whether you're on a tablet, it's always going to be consistent. They have some really great features, which would include for boards as you're going through your the notes, or you're going through the agenda items. You can create notes right there, and you have them right next to whatever you want to do. If you're not tech friendly, there are solutions and ways around this. So what we can basically do is get you access stored on your computer or your tablet or whatever we have. And you basically, all you would do is, I would send a note saying, hey, it's ready. You push a little button and boom, it's there. While we're in board meetings, there's someone who actually would drive, and you can actually put it on autoplay. So it's, if you want to scroll through yourself, you can, but you can basically watch TV, and everything will come up for you, and you can go right along with your notes and your agenda and all that. In addition, we can load up, we can archive 5-10 years of board notes, committee meetings, whatever we want to do, and there's a calendar on there for events as well. So every time something new gets put on, they'll automatically be notified, hey, there's a new event added to the calendar. There would be a 45-minute training for board members if you are interested in this. The initial cost is, it's not too bad. It does go, it's the middle cost is a little heavier in the first year because they are actually archiving all of our old items. But then it would decrease. They also offer a substantial referral bonus per year. So
It would, aside from the initial, it could be initial year cost, I think is an extra $500 in the annual cost to archive, but it basically comes out to be about $200 a month as a service. But if you look at the amount of paper and I think time alone from our employees, and there would be some time of Nicole's to upload things, but I think substantially less than what she spends now in assembling paper packets. So I think at the end of the day, it would be probably a fiscal wash for us, and it's not substantial cost. So, we're not looking to, this is something I wanted to introduce to the board this month and, get some input, thoughts, feedback. If this looks like something that you would be interested in, let me know and we can start to move forward with investigating this. Again, for those, we have some board members that tend to, I'm one of them, I have my iPad, we use that. For those that aren't, there are ways around, solutions around. We can put things up here, we can utilize equipment we have here in the office, I think.
we actually also looked into the possibility of this for those that don't know that, the CBA Chromebook, which is
So,
far away.
and so there are solutions for that we could use for those commissioners that don't have either tablets or laptops that they use on a regular basis.
So the difference of this and base camp is that archiving the additional information.
Not only do you have an archive and you have a central location for everything, but you also think of all the things that we get requests for, so bylaws, committee meetings, those kind of things. In addition to that, you also have a central location for calendar, and the biggest issue is time saving, not just for me, but for Alan and IT and all the things that we do to upload. The other benefit is the fact that no matter what device you use, because it's cloud-based and not PDF-based, you have better access, more consistent access, and it's consistent access.
Plus, at the same time, you can also print the documents on in any type of format. If I remember right, they said something about posting the agenda as soon as she hits send, it posts on our current website.
Yeah, it automatically links to our site as well.
In addition to kind of going green with our board packets, we have a lot of good board members who will email Nicole or George or Cliff or me. I need a copy of our bylaws. I need a copy of our board policies. I need a copy of our handbooks, our financial policy, all of those documents that are kind of our reference documents, as opposed to either having to house them somewhere in your office or doing what I do, which is then digging back through. I probably at least once a week run a search in my email on the last name Molina just to pull up things that Nicole has sent me. So instead of having to search through things or keep a receptacle on your computer, whatever, there's a place where, as Nicole said, we'll go back with all of your board packets. If you want to look at a board meeting, any notes from last year, they're there, they're easily accessible, you're not wasting much of your time or somebody else's time to pull them up. So having the receptacle for all of our governance documents and our reference documents, I think, is a huge added benefit.
They also have one other feature for when you were talking about policies and stuff like that. There's a reference button on the side, so if you needed to know something about a handbook policy, you can click on a link that will take you to the handbook.
So with archivable information and information with the board, will we be able to search in a
PDFs or terminology, and so.
Yeah, they do word search.
Okay.
The search, as we just said, the search functions are fantastic, and I actually do create links. So if you're in something and you want to reference another article, you can just search it and it pops right up for you. We'd be happy to do a demonstration if you want to.
It is much more, from what I say, much more dynamic than your straight kind of FTP type of.
Correct.
So, at this point, this is an introduction to new business. I will take over the next month input or comments from the commissioners if we want to see a demonstration. Otherwise, I'd like you to consider letting us move forward with input. So I would ideally put a request to do this on the either next month or July's board meeting. But I'd like some input from the commissioners over the next couple of weeks.
Would it be possible for the next month's board meeting, rather than trying to set up another time, to do a short demonstration?
I can call for a demonstration.
Okay. See if we can make sure work. I'd like to see the demonstration.
George, do we have to clear this?
What we'll probably do is I'll probably look at an in-local agreement, because OPS, Miller, some of our local school districts, use this
They use the
system.
system.
So we just make sure that the recruiting procedures are satisfied with the teachers. It's a $2,500 annual fee, so that's just a free quote. So I'm guessing when they in their system, they probably did something similar. So we'll probably look at a local agreement with one of our sister organizations around the community.
So we'll see if we can get at least a small presentation demonstrations out of next month's meeting. Great. Thank you. We do have one very, very brief item to cover in executive session, so I'll take a motion for somebody.
So moved.
Legal purpose.
Legal.
Legal purpose.
Roll call.
Motion to go into, let me make it formal. Motion to go into executive session over the discussion.
Thank you. Roll call.
Commissioner Winfrey?
Yes.
Commissioner Burgess? Commissioner Gray?
Yes.
Mr. Watson?
Yes.
Chair Taylor?
Yes. I'm 5 minutes. Oh, forgot about that. Okay. 5 minutes. And then we'll do a quick foundation meeting, which should take a little more than 5 minutes. So we'll be out